Dr. Agasha Doreen Birungi. I work with the Uganda Blood Transfusion Services, and I am based at the Gulu Regional Blood Bank. And today we are having a blood donation drive organized by the Uganda Cooperative Alliance, Uganda Blood Transfusion Services, Ministry of Trade, and Ministry of Health. And we are very grateful for this opportunity. I'm told it's a nationwide activity, but for us here in Gulu, we are stationed right now at Laibi Market, and we are hoping and waiting that people can come and participate in this exercise. It would really be a good thing. Blood is a very important resource, and we are not able to manufacture it anywhere. We can only obtain it from willing people that feel the interest and the desire to donate, and yet also eligible, because we do some level of assessment to make sure that someone is an eligible donor. And we make effort to go out there and look out for these donors, inform people, make them aware, and then see if there are any that are willing. Some of these exercises are not exhaustively done alone as the blood bank, and that is why we like to do them also with partners, because they come in and really assist us in the mobilization effort. We know very well that attracting society to different activities, it depends on the interest of the people, and that is why Ministry of Trade has also come out today with the Uganda Cooperative Alliance to engage with the blood bank and see if they can mobilize donors on our behalf. And we are very grateful.
What's the situation with the blood stock currently at Uganda Blood Bank within Acholi sub-region?
That is a very difficult question. For one thing, blood is always being taken out. It is very, very rare for us to say we are keeping blood and keeping a certain store, meaning it's in great demand, much greater demand than what we are able to collect. So any effort to increase the collection exercise is very welcome, and that is why we are here today.
So when you go out within the community, what's the turn up of the people? Do you get sufficient units of blood?
Depends on different communities. Some communities are very responsive. Sometimes we get over 100 units, but some communities are not that responsive. Schools are much easier to mobilize, and those are some of the places where we've received a lot of support in terms of donation collection exercises. So it really depends on the community.
So are you afraid sometimes when students are sent out home during holidays that the stock dwindles a little bit, what you get?
The holidays are tricky generally, but together at the blood bank and with various partners, we are devising ways and means of increasing collections even within the communities. And that is why blood collection exercises happen daily at every regional blood bank, even at Nakasero. We have to keep on going out there to collect and replenish stocks. So innovations are very important, and that's why we are happy to work with various partners to see how to improve some of this, especially in the community.
So what would you say is the required unit of blood that at least you need to have, each and every time that, you move out, so that when the demand comes from the various hospitals, you are certain that even if today you don't get it from here, at least you have something within?
That's a very difficult question to answer, because it really depends on the demand from the hospital. So when we come out here, for example, a day like this one, we are hoping to get at least, maybe 100 or 50 donations here.
What would be your appeal to the community within Acholi sub-region where you are making these drives for blood donation?
My appeal is to the community to request that we get involved in blood donation sessions and exercises, work with the blood bank, so that we can get more and more people donating blood, so that we can have more and more blood, enough to serve our community here in the Gulu region. It's not a very easy thing to do. I think some people are scared or some people are uncomfortable, but it's good when you come, when you see the teams out there in your communities, come, get all the information, let us share with one another, and at the end of the day, you might be that one person who provides a unit that saves a life somewhere in a hospital.
I'm called Ochen Alfred Langol. I work for Uganda Cooperative Alliance. Today we are in Laibi Center with the Gulu Blood Bank, Regional Blood Bank, as one of the activities for the Cooperative Day. Cooperative Day always happens on the first Saturday of July, but this time we delayed a bit because most of the cabinet members were for a retreat in Chankwanzi, and we have had to postpone until 20th of July. We have lined up several activities in commemoration of Cooperative Day, from blood donation, community concern. We are supposed to have cleaning of the health centers, tree planting as activities under the same theme. Our theme for this year is Cooperative builds for everybody. That's our theme for this year, and we are here in Laibi Center to collect blood, and we invite everybody to come and donate blood for saving lives. We know blood saves life, and that is why we have taken it on, because we want to save life. Cooperative builds a better future for everybody, and that we have chosen that theme because we want to expand. We want everybody to know that cooperative is the way to go. That is basically why we are here today in Laibi Center, and we are inviting everybody to come and donate blood, because cooperative builds a better future.